Okay, everyone clear? I'm clear, you're clear, we're all clear?
Yes.
Shock delivered. Resume CPR, bag mask ventilation, please. What I need you to do is hit the start pacing button. Good.
Can we get a new blood pressure?
We're in the Astec simulation lab at the College of Medicine, where medical students, residents can practice different surgical techniques, situations that you'd face in real life.
We have a patient made of plastic and a variety of other mechanical substances. We call him Stan, and he's a great patient because he never talks back, he doesn't feel pain, and even when he dies, we always know that we can bring him back.
So this is a 24-year-old construction worker. He was outside. Suddenly...
There are some people who find the mannequin to be a little bit creepy. Usually we just kid around about it a little bit at the beginning and try to counsel people to really try and treat this like a real patient as much as possible. All right, are we ready? All right, so we need you to set up the case. Realizing that oftentimes for the first few cases, it just doesn't really click, which is why we run several cases.
How much of Narcan? Sir, you awake?
You're not feeling any pulse.
Please initiate CPR. Okay, so that rhythm is ventricular fibrillation, so we're gonna go ahead and charge to shock.
I'm clear, everyone's clear?
Clear.
Shocking.
Shock delivered, please resume CPR.
In the first simulation, I felt pretty unprepared in that it seemed a little chaotic. None of us really knew what we were doing.
As far as like the anaphylaxis, we knew give epinephrine, but after that we obviously didn't know what to do. So that was something we were taught in the classroom, but we didn't go follow it through all the way.
Yeah, everybody knows the epinephrine. Give the epinephrine, that's the immediate relief. But, oh, well, what's the cause? We need to address the actual cause. And coming to a simulation lab like this where they have computer programs that can make it appear, oh, wow, his oxygen saturations are not getting better, his blood pressure is not getting better, he's declining, his condition is getting worse. And being able to see them artificially change that stuff and make you think of, well, what am I missing without an actual life being at stake is very valuable.
Come a little bit more out of the way, stick this in through the side, and then just flip it up when you get the tube kind of close to the cords, okay? So let's try again, all right?
Are we okay at 85?
While you're in the situation, it definitely feels very real. You have, each of us were a different part of the team, and we had, a team leader, a nurse, a resident, and so we're all sort of have responsibility that we have to carry. And so keeping that in mind, it makes it very real, even though we're dealing with a plastic dummy with, fake veins and fake blood, but it still feels pretty realistic.
I'm getting a chest rise, but no CO2.
Say you were running a code and we didn't have someone like Dr. Meinke here to help us with the actual procedure. If we missed an important part, they could make the patient pass away or something could happen to the patient. And though it's artificial, you still feel like, well, we lost a patient.
Well, I can't say I've lost any. I think you guys did a nice job recognizing very quickly that this was cardiac-induced chest pain and appropriately administered. I do think that there are a lot of things that can be learned from working with a patient that's kind of absent of a personality. I mean, there are a lot of really important procedural skills that can be practiced. So if you were a patient, you might not want a medical student to do an IV on you knowing that they've never done one before in their lives and that you're their kind of practice person. Here we can have students come in and fail over and over and over again and then be successful. My theory about why Astec is important is mainly because it allows people to practice in a situation where we're not putting any patients at risk. Nobody is going to suffer pain. Nobody is going to suffer any bad outcomes. So you allow people to do the same procedure with the supervision of a professional until they get it right. And there are quite a few studies out there that show that simulated training is of benefit to the trainee and probably to the patient, depending on the procedure and the situation in the future. Okay, very nice.